Okay, our live stream and recording have started. So welcome everyone to the first meeting of the Longevity Ready Maryland Stakeholder Advisory Group. This meeting is the official launch of our stakeholder work groups, and we're just really excited to be here with you. My name is Liz Woodward. I'm the Assistant Secretary for Planning at the Maryland Department of Aging. We thank you very much for joining us today and making an impact on how Maryland enables healthy, long lives. All of you have the really important opportunity to identify solutions and shape priorities that will inform our state strategic plans to support Marylanders as we age. During today's discussion, we'll learn about the Longevity Ready Maryland initiative. We'll introduce ourselves to one another. We'll discuss the purpose and context of the work we'll be doing, as well as our operational guidelines. And then finally, we'll break into discussion groups to begin planning for our work group meetings. But first, we're going to hear opening remarks from Secretary of Aging Carmel Roques. So Secretary Roques, I'll pass it to you.
Thank you, Liz, and team for organizing this meeting for us. All of you who are here, I want to just express my deep gratitude for your time and your attention to this incredibly important endeavor that we're all engaged in. I know that, time is one of those precious gifts that you can give to others. And so I want to acknowledge that up front and say that none of this would be possible if you hadn't raised your hand and said that you would be willing to participate with us. So when I think about a way to sort of frame this work, I go back to what I think of as the essential role and responsibility of the Department of Aging in Maryland. We're a cabinet level agency. That's not true in every state. And so we have that as an added advantage in the work that we do. And our role really is to prepare Maryland to be able to effectively address both the challenges and the opportunities that come with longer lives. And longer lives are already here. We know that there is work to be done so that there's equity in terms of lifespan in Maryland, but this issue of people living longer is happening right here in Maryland, in the country, and across the world. And so our responsibility at the Department on Aging is to be prepared for that and to take the most sort of aspirational and longest lens for the work. I like to think in terms of the 100-year lifespan. The 100-year lifespan is going to be the norm for the 5 and 6-year-olds of today. And for many of us, living into our 80s will be normal. And so what we need to be able to do is to think about the norms, the policies, the institutions, the investments we need to make so that today's young people will be the future's older adults, and they will be healthy, and they will be financially secure, and they will be socially connected, and their lives will be full of purpose and meaning. In other words, we want to help set the stage for Maryland to have a thriving older society, because that's what we're headed toward. And all of you can help us make that happen. So the long range and the multi-sector plan is a 10-year plan, and you're going to hear all the details about that and the model that we use, et cetera. But it is long range. It does look far into the future. And as you all know, we can barely predict effectively what's going to happen next month, or when the election happens, or in the months to come with our climate here in Maryland. So there are variables out there that we can't predict, but we can set a path forward, and we can have some goals that we set out that we know we can work for and toward. And that's what you're going to hear about today, the framework for that, and getting us started. I also want to share that when we started this important work and this role as an agency in Maryland, preparing Maryland for longer lives, becoming longevity ready, we first and foremost address the fact that how we think about things informs the kinds of plans we come up with, the interventions we come up with, where we put our resources and make our investments. And we address the fact that the way we think about aging, older people, and the meaning and purpose of these longer lives directly impact the kinds of institutional changes that will need to be made, the systems changes, and the norms that will need to change. And so I hope that you will consider your own biases around aging as you're doing this work, and let that help inform you as you move forward. So one of the things that I always think about, particularly when we're thinking about things that are aspirational, but also things that have near end goals, because this work will also be creating the first 4 years of the 10-year plan, the first 4 years being our state plan on aging. I like for us to think about what is it we actually think will be different. And that's what we're working toward. What is this different world? How will it look if we do the things that we're proposing? So you all are in the process of basically imagining and then bringing into creation an entirely new world, one that's not here right now. And I know that you're up for it. I know collectively you're going to do a fabulous job. I wish that I could attend every meeting of every group, but we will have a time when we get to come together throughout this process. And then when we present our plan, we begin to work on implementation, I know we will all be working together again. So on that note, let me just say thank you again. Please, calm your minds, open your hearts, and let your imaginations run wild. So on that note, I'm going to turn you back to Liz. Thank you.
Thank you very much. And I'm going to pass over to our Deputy Secretary, Jennifer Crawley, who's going to take us through our introductions.
Good afternoon. I can't tell you how thrilled I am that we are at this point and around this collective virtual table beginning our Longevity Ready Maryland work. So welcome to all of you, and thank you, Secretary Roques, and thank you, Liz, and the whole MDOA team for getting us where we are today. And so we wanted to do some introductions. There are a number of you here, and in the interest of time, I'm going to ask that our Maryland Department of Aging team wave rather than actually introduce ourselves. And so if all of our MDOA team can kind of put your hands up, and these are folks who you will see throughout our work groups and will be your resources and supports through this process, both with our larger work groups and also through the Stakeholder Advisory Group. And so my utmost gratitude to our team. We would not be where we are today without all of the expertise and energy and wonderful work that all of our folks have provided. So with that being said, I would like to introduce our Stakeholder Advisory Group members, and just want to share that each of you are representatives for our larger work groups, and that you are here today because either you're a subject matter expert, you are a person with lived or professional experience, and you bring something unique to this process in a unique perspective. And so as we go around introducing ourselves, I would really like for you to introduce your name, your affiliation or experience. So whether you're with an agency or an organization or a member of the public. And then lastly, what unique perspective do you presenting? Did I freeze?
Just briefly.
Okay, so the last part of it is, so name, affiliation, or experience, and sharing what unique perspective you bring to the stakeholder advisory group that will be useful for informing our Longevity Ready Maryland process. So I was trying to think of what's the best way to do this. So I think I am going to go according to my screen, and if I mispronounce your name, please correct me. And I'm going based on what is here on the screens. So I'm going to start with Brenda Salas. And if you can unmute yourself and introduce yourself.
Yes. Well, thank you so much, Jennifer. I'm Brenda Salas. I'm with the Employee Benefits Division, and I manage the state of Maryland's wellness programs. So you may know me from the newsletters that go out and the webinars. My unique perspective is that I taught for a decade at Montgomery College in Montgomery County, and my courses were health education, healthy aging, and then on to physical education and anatomy and phys. So I've got a nice broad background for that. And I'm very happy to learn some more things through this work that we're going to be doing.
That's great. Thank you, Brenda. John Brennan.
Yes, hello, good afternoon. Thanks for having me on the work group. Name is John Brennan. I work for the Maryland Department of Disabilities, and in terms of the unique perspective, I think that's it really, is my work over the years in the disability field. Eventually, most people will develop some sort of disability if they live long enough. And I've worked in a number of different aspects on disability policy related to affordable housing, which I think is going to be, is and will continue to be a huge issue going forward for this group, as well as non-visual access related to accessible technology. And so I'm very interested and intrigued by trying to figure out how we prepare, in the future, or provide that roadmap that the Secretary mentioned as to how people are going to, be able to age in place and stay part of their communities. I think the definition of the way people look at things is really going to change radically. So it's interesting to be part of this, and I appreciate you including me.
That's great. Thank you, John. As you all are experiencing our connectivity issues, this periodically happens where we freeze. So apologies for that and bear with us. We hope that our connectivity will be improved once our department moves to another building in the near future. So thank you, John, for that introduction. Yang Yu.
Jennifer, thank you, Liz. My name is Yang Yu. I'm from Howard Community College. I'm the Associate Dean of Liberal Studies, and our Liberal Studies division offers courses such as aging, public health, and nutrition. I collaborate closely with the department chair and faculty to enhance and develop our services and programs to better support the needs of both students and the community. And I'm also the chair of the Governor's Commission on Asian Pacific American Affairs. So as part of my community services, I actively participate in AARP, Maryland Asian American and Pacific Islander Consortium meetings, where I engage with issues affecting older adults within the AAPI community. I'm so honored to join this group and look forward to working with you all. Thank you.
Thank you, Yang. Ash?
Hello, everyone. My name is Mahpesh Ashraf. A little bit complicated to pronounce, but that's how it is. I'll be working as the chair for one of the work groups that is promoting economic opportunity for all. As long as the experience goes, I had been affiliated with a private hospital working in nursing administration for a while. And for the last 10 years, I had been working with elderly people within my community. I'm mostly associated with the diverse community when they move from their countries and then come over here, what challenges they face, what are their issues, and then kind of just helping them ease into the process of adjusting over here. So that's my experience. Thank you so much, everyone. Really thrilled to be a part of this group.
Thank you. Jim Sanders?
So I'm pleased to be here. So I come at this with three lenses. One is I'm a professor of both Johns Hopkins and the University of Maryland Business School, where I teach innovation around social entrepreneurship. Second, long experience in the village movement and very interested in community-based ownership of their health. And then third, I'm very involved with the housing field and affordable housing, and I've done a number of projects on ADUs, and so essentially, I'm an advocate for improving housing. That's all.
That's great. Thanks, Jim. Jen Holtz.
Hi, excuse me. Good afternoon, everyone. So good to see you. I do apologize. I have to switch back and forth between camera and no camera. We've got a school pickup and varsity soccer this afternoon. So thank you for your patience. I'm Jen Holtz. I'm one of the Associate State Directors for Outreach at AARP Maryland. We're a small team of 7 who are considered basically the local boots on the ground for the organization. And we conduct outreach and advocacy across the entire state. We work with a team of about 300 volunteers, and I think that's part of our unique presence / perspective. I've been with AARP for 18 years, and really, while we are, especially at the state level, not necessarily a direct service organization, we do have power in our membership, research, data, like I said, the volunteer presence that we have, the good resources that we provide to the 50+ population to help them live their lives as they choose. And that's really what we're looking for here, is when it comes to folks' health, their wealth, and their self, what makes them happy. That's what we want to focus on, is letting people choose how they age. So thanks for having me.
Great. Thanks, Jen. Nancy?
Hi, everyone. My name is Nancy Junta, pronounced like the month June. I'm really honored to be here, and I am an associate professor and chair of the social work department at Frostburg State University. It's a bachelor's in social work program. I've been here in Western Maryland for working here at Frostburg State for about a year. Prior to this, my experience has been in kind of urban aging environments. So I've worked with the Department of Aging and Adult Services in San Francisco, the Department of Aging in New York City, where I served as an associate professor of social work at CUNY Hunter College. And probably for the last 30 years now, I've been involved in different types of long-term care service innovations. I started out as a hospice volunteer and then did some work in caregiver advocacy, home and community-based service programs that work on case management to keep people out of nursing homes. And now that I'm in far Western Maryland, I am learning and hopefully sharing with you about rural aging.
Jenna, you were frozen for a moment. Say the name again, please.
That's what, yep, that's what I thought. Nancy, thank you. Teresa.
Teresa, I believe you're on mute or might be having some challenges with your speaker because we cannot hear you.
No, we can't. No, we can't hear you.
So maybe could you please type into the chat and we'll read it aloud. Thank you.
Sorry, Teresa. We'll go, we'll read you next. We'll go to Mark, and then as Teresa types, we'll read. Mark, oh, there you go.
Yeah, I'm hopping in. So, good afternoon. My name's Mark Ritterhoff. I wear different hats on different days. So, I'm a psychotherapist in the Baltimore area. I'm also president of PFLAG Baltimore, and I'm on the State Commission of LGBTQIA Affairs. So, I look at aging as something with a particular lens for the queer population and the challenges that they may face that might be just a little bit different than other populations. I think, did I hit all the questions?
Yep, that
Okay.
was perfect.
Excellent.
Thank you. Thank you so much. Teresa, or sorry, I know I just called Teresa, but I'm not seeing anything yet. Let's see. All right, let's go to Jane.
Turn on my camera here. Hi, guys. I am so excited about this. So thank you for having me join. And I know quite a few of you who are on the group. So I have about 35 years of experience in the long-term care marketplace, based on developing care models, the built environments, affordable housing, everything from the Greenhouse Project to the Eden Alternative to now we're looking even at the Minka a little bit. Thank you, Bill Thomas. And we've been working a lot in Western Maryland. I actually know Nancy really well. That's how we got to know each other so well, and working on some things out there. And Carmel and I used to work together on Keswick. So there's just a lot of wonderful, wonderful connections here. And so my affiliation is Live Together. I have JSR Associates as my consulting practice. I used to work at Ericsson, and then from Ericsson went into my own consulting practice in '96. And then since then, 5 years ago, we started Live Together, which is a nonprofit based on intergenerational living. So it's taking all those lessons learned from the 30 plus gazillion years of work and putting that together into something that looks like intergenerational living. It looks at housing, engagement, and also workforce development, because we know that that's a strong component of those. So I'm very excited to be here, and thanks for inviting me to join.
That's great. Thanks, Jane. I'm going to read Teresa's introduction. So this is from Teresa. My name is Teresa Robertson. I co-chair the Maryland Commission on Caregiving, and I'm the founder of Hope for the Maryland Caregiver. My unique perspective is that of a 25-year working family caregiver to my husband, Emmanuel Robertson. Thank you, Teresa. We are so glad you're here. Wonderful. Next person, Catherine.
Hi, good afternoon. I'm thrilled to be here. Thank you so much for the opportunity to participate. I am an assistant professor at Johns Hopkins in the Department of Health Policy and Management. I'm a health services researcher by training, but I bring an economic perspective to most of my work, and I focus on understanding how different policies impact the long-term care workforce, specifically direct care workers and family caregivers, how that then impacts the quality of care that's provided and ultimately patient outcomes. In addition to my affiliation, my home at Hopkins, I'm also affiliated with several VAs. I do a lot of work in the VA, helping to evaluate the VA Caregiver Support Program, as well as the VA purchased home and community-based services. So really, again, excited to be here, and thank you.
That's great. Thank you. Now there's a phone number, a 443 phone number. I'm not sure if that's someone who has already introduced themselves or not. Maybe. Okay, I'm going to go to Pazit.
Hey everyone, my name is Pazit Aviv. I am hailing from Montgomery County, Maryland. I have been working with Montgomery County Aging and Disability Services for the past 10 years as their village coordinator. So I'm really glad to see you, Jim, here. And we've been working a lot together previously. My background and perspective is pretty much focused on aging in community, with some experience working with lower income folks at the local housing authority and thinking about what it takes to age in place when you have very little resources at your disposal, thinking about building local capacity and infrastructure using community-based approach to aging, as well as working robustly with our Commission on Aging. And we will have several of those commissioners joining us as part of the work groups and thinking about issues of policy, overall advocacy, and building capacity. Thank you.
It's great. Thank you, Pazit. Allison.
Hi, everyone. It's such a pleasure to be here, and it's great to see so many familiar faces and meet new folks. I'm Allison Siborowski. I lead Leading Age Maryland, and we're an association of not-for-profit aging services providers, and we represent about 150 different communities, and a large number of our members are affordable senior housing providers. And I'm really excited to be part of this work because there's just such a need to be able to expand the work of the amazing not-for-profits that do work in our state to support all of us in having opportunities for aging well. So I'm really excited to be here.
Thank you, Allison. Dr. Begg.
Hello, good evening, good afternoon, everyone. Hi, I'm Dr. Begg, Bisma Begg, and by profession, I am a former OBGYN, and my current very relevant, I must say, though it's a different population, but I have developed women's health education programs for state of Maryland prison system. So I really, because my background is also in public health, I am a graduate from Bloomberg Hopkins with an MPH as well. So it was my idea when I transitioned my career to collaborate my clinical background with the public health so that it will give me a broad perspective, on policy, health policy, and social determinants of health and health, life course perspective, so that when we analyze some root cause analysis, we could be better at those. So I'm also serving on Board of Health, Howard County, as a member. And I'm also on another authority, Maryland Health and Higher Education Facilities Authority, as a commissioner appointed by our governor. So I'll be serving this term for both boards. And I'm very happy and honored to be here because in prison system, since I have developed I wrote the curriculum, I have developed women's health education programs, and I see that how aging and social determinant of health with our low to underprivileged populations, they work. So since we are very much focused on Maryland and Baltimore communities, and most of the populations, of course, represent Maryland in the female prison system. So I have seen so much and learned so much myself. I educate them, I facilitate groups as well, like 6 to 9 per week. And it has been very eye-opening experience as well, because in books we read, but in real life experience, we see each individual as a generation. So I'm very happy that I can contribute to, contribute towards healthy aging, and women's health is postmenopausal women, perimenopausal women. They really represent a huge population. So I'm glad to be here. Thank you.
Thank you so much. Thank you, Dr. Begg.
You're welcome.
Stephanie.
Hi, thanks for having me. I'm really happy to be here. Delighted to be a part of this work. I am the Executive Director for Meals on Wheels of Central Maryland, and the perspective that I bring is the sort of direct experience with the variations in aging and how differently people age depending on their where they live, the resources that they have, the safety net that they have in place. And so, and how detrimental it can be when those things are frayed in some way or not adequate. I also bring the perspective of developing services that fill those gaps or try to attempt to fill those gaps. So, thank you.
Thank you, Stephanie. And then last but not least, Sean. I don't know if you're able to come off of mute. There we go.
Can you hear me?
Yep.
Okay. So many problems today, but happy to be here. Wouldn't miss it. So So I'm with Montgomery County and currently coordinating age. Previously worked for the Area Agency on Aging as Health and Wellness, and worked in transportation and mobility, and worked with the Commission on Aging. And prior to working for Montgomery County, I worked with a number of disability-oriented organizations. So I was really happy to see how much, we're bringing these two populations together on common areas of concern, and just very happy to share whatever we've learned, and really eager to learn from everybody else in this process. So thank you.
That's great. Thank you, Sean. Well, I think I got everyone. And my takeaway is just, wow, what an amazing group of folks with varied interests and experience. And I can't wait to see, what comes of the Stakeholder Advisory Group and all of our work groups. This is a really remarkable group of people who are going to be advising our Longevity Ready Maryland process. So thank you for being here. And with that, I will hand it over to Liz.
Wonderful. Thank you. Thanks for taking the time to give us your introductions. Very exciting to learn from all of you guys. So I'm gonna just take us through, we're gonna get into the purpose, context, operational guidelines. I'm gonna try and go a little quick so that we can make sure to get to everything else. So to start us off, as you've heard, we have a vision here at the Department of Aging that's really guiding this work. And you heard about that from Secretary Roques. We've used a number of existing frameworks to inform our approach on the state level. We really wanted to share the National Academy of Medicine's 2022 Global Roadmap for Healthy Longevity, frames the conversation in this way. I'm going to quote, "A clear-eyed, evidence-informed view of the capabilities and vulnerabilities of older people points to the very real potential of aging societies to be, on balance, positive. It is important to recognize the substantial socioeconomic gradients that drive vast differences between advantaged and disadvantaged populations within and across countries. Together, these observations suggest that long-lived populations are not an inherent problem for societies. Rather, the problem for societies is the barriers that systemically prevent people from reaching their later years with the good health needed to thrive and contribute to family and society." That's the end of the quote. So we recognize the major disruptors to healthy longevity include ageism, preventable disease, poverty, and inequities. For Maryland to be prepared to meet the needs of today's older population and build for a future of healthy longevity across the state and all of our communities, long-standing systemic inequities and disparities experienced across the lifespan must be addressed. So that's why we're here. Each of you is chosen to work within a particular EPIC goal based on what you bring to the table. And as we heard, you bring an awful lot to the table. We're excited to have you. Recommended priority areas are included in your work group information and resources packet. And while those are based on a combination of contributing factors, your work group may find that some areas are greater priorities or have potential for greater impact than others. We know we can't do it all. So here are our EPIC goals: to build a longevity ecosystem, which we've included items like supportive and inclusive communities, addressing ageism, systemic inequity and elder justice, and building collective capacity through local leadership. Promoting economic opportunity, including caregiving and care workforce, multi-generational workforce, and employment for people that are 50 and over. Preparing Marylanders to afford longevity, with recommended areas like affordable housing, affordable healthcare, financial security, and access to long-term services and supports. And optimizing health, wellness, and mobility, with the priority areas of person-centered care, transportation infrastructure, brain and physical health, and social connections and a sense of purpose. A quick note, some may wonder why we talk about the 50+ population and how we define an older adult. We're using data around 50 and older population because some areas, especially like workforce, use this age as a cutoff for an older person. But the primary reason is that this is a 10-year plan. So in 10 years, everyone 50 and over will be 60 and over, which is the target population of the Departments of Aging Services under the Older Americans Act and many other programs. We just wanted to share that. Some meeting logistics. So per Maryland's Open Meetings Act, all information will be posted online. Due to the public natures of this meeting and all of our meetings, we expect everyone participating to demonstrate professionalism and respect at all times, which I'm sure you do. The meeting agendas and minutes will be uploaded to your work group folders within 2 days of each meeting, and links to those folders will be posted online and accessible to the public. Your work group chair will lead your meetings with the assistance of our team here at the Department of Aging. While each of the 4 work groups has unique responsibilities, there are collective procedural considerations or values that are common for all. Several of these considerations are factored into the template that you'll use for creating your recommendations. So it's important to not lose sight of them as you do your work. So quickly, they're building upon existing plans, recommendations, and resources, improving efficiency and collaboration across sectors, promoting equity, social justice, and inclusion, enhancing access to technology-based solutions, ensuring person-centeredness and choice, and promoting community-led design, execution, and evaluation of solutions. There are many different levels of recommendation your work group might want to consider. The socio-ecological model of health behaviors is a framework of influences on individuals and communities that has been adapted by public health professionals on how to approach health behavior change for decades. You can see here, the public policy level encompasses impact on community, institutional, interpersonal, and individual levels. That public policy level is really what we're looking for our recommendations to be. Just a great example that one of our chairs brought up was around oral health. A public policy level recommendation may focus on expanding health insurance options to include dental care, while a community level recommendation may focus on funding a specific oral health program in a targeted jurisdiction for up to X amount of people. Both will be hugely beneficial to improve oral health, but the public policy will have a larger statewide impact. So that's where we're looking to focus. All right, you received a resource packet via email. Please review it closely. This packet includes information and links to just about everything we think you need to get started. The file sharing platform we're using is Google Drive. It is publicly accessible. Each workgroup folder includes subfolders where meeting agendas, minutes, and work documents and additional resources should go. A contact list of workgroup members is also in your folder. You will see lots of information about existing state agency initiatives, as well as state and national reports, briefs, planning documents, and data sources. These resources are intended to jumpstart you on your path towards developing recommendations. So as we discuss, the recommendations we develop as a group should build on existing plans, recommendations, and resources. We do not want to recreate the wheel. We want to take what's out there, think about how to make it impactful, relevant, and actionable in our state, and fill in the gaps. All right, so chairs and Department of Aging staff have already begun meeting and will convene again today, hopefully if we have time, to begin planning for our work groups. It is recommended that you spend your first meeting introducing team members, discussing recommended priority areas, and considering what breakout committees or assigned roles your group may want to consider. Work groups will create a schedule that includes researching available material and identifying any gaps, defining your work group's objectives, creating strategies for meeting those objectives. As you can see in this slide, we're limiting the number of objectives and strategies, so you'll want to think through priorities. Please use the available template in your packet for structuring recommendations. And we'll talk more about that in future meetings. All right, the Longevity Ready Maryland process includes coordinated input from all of these different groups. So work group members are making recommendations and providing supporting information related to the group's assigned goal and priority areas. The chairs will lead each work group, creating meeting agendas, assigning roles, coordinating actions, and participating in the stakeholder advisory group meetings. Here at the Stakeholder Advisory Group, we will be coming together between work group meetings to discuss progress, identify redundant conversations or gaps in our discussions within the work groups, and ensure that we're progressing towards our aim of developing objectives that are specific, measurable, achievable, realistic, time-bound, inclusive, and equitable, and that have short, midterm, and long-term strategies involved. We have a Cabinet Advisory Council that will review and edit and improve recommendations before they're shared for the public review and comment period, really ensuring that this can be an actionable plan. And then we at the Department of Aging are coordinating the development process. We're preparing the draft plans for review by the governor and ACL, and we're completing sort of the final plan. What we don't have listed here is Marylanders who join the meetings as members of the public and participate in our open comment period, who will help to ensure that we are looking at the full context and making recommendations that will be impactful based on the opportunities and challenges they face. Here's our timeline. November 15th is the deadline for work group recommendations. From there, the Cabinet Advisory Council will review, confirm, or recommend necessary edits to our plan to ensure it's actionable. And then we're ready to share with the public for input in January. Following public input, the Department of Aging will prepare the plan for review by the Governor's Office and the Administration for Community Living at the U.S. Department of Health and Human Services before the final plan is submitted in July of 2025, once approved by those entities. After that, implementation and annual reporting of our plan continues through December of 2035. It's important to know that the development of this plan is not an ending point. It's really the beginning. The department will be establishing a public dashboard to track progress and will continue with stakeholder engagement to move the plan forward, including engagement of state and local partners and members of the public. And I mentioned the dashboard here. We actually anticipate having a version of our dashboard with existing data, really bringing together a lot of existing data sources. We anticipate having it prepared later this month, and that'll be available to the work groups to use to inform their strategies. Great. I want to open briefly for burning questions and comments. Are there things that you guys really need to know that were not addressed here? And you can, again, take yourself off mute. You can enter into the chat. You can raise your hand.
This is Jen Holtz. I just have a quick question. You may have, gone over this and I missed it, so I apologize. But as a stakeholder advisory group member, how are we receiving updates, information, anything coming out of the work groups in order for us to keep tabs on that work and make sure there's no redundancy?
Yeah, so as SAG members, you are all participating in a work group as well. So everybody has been assigned to a work group for participation. So if you're not sure which work group you've been assigned to or haven't received a reach out, please put some information in the chat and we will follow up because you should have received that. So in part, you're doing that for us, right? And this group has members of all the work groups so that you can come together and say, well, this was really what our conversations were. Here are the key themes we're seeing. Here's what we are working on. And then we can identify across the SAG group, is that redundant with others? Should that conversation be happening here or there, and can make some decisions about that. So our chairs will really kind of be leading that work. Since they're leading these work groups, they'll be able to kind of help think through those themes. But we, as a SAG group, will be working through that together, bringing information that we think is relevant, and then working to build it, to build our understanding collectively. Additionally, as we develop that template through each of the work groups, it'll be the SAG responsibility to kind of review that and identify, where we might have some gaps or redundancies, or could kind of strengthen the measurableness, for example, of our strategies. And so we'll be bringing up materials throughout these meetings. Following this meeting, I'm going to be sending everybody a link for a scheduling poll to schedule the rest of our meetings. So meetings 2, 3, and 4. And those are kind of placed in between your existing work group meetings so that you'll be able to come inform based on what happened in the past meeting and plan for the next meeting collectively. Any other burning questions? Okay. And if you decide you have some, please feel free to email me. I'm going to put my email in the chat as well. But I think that leaves us with some time left over to get together as work groups.